Well, hello, my name is Jerem Dastrup. I am an employee here at Dental Intelligence, and I know a lot of you that will be viewing this have attended a lot of the webinars that I've been a part of, and especially over the last couple months as we've been working through some very difficult times, and we've seen some incredible light at the end of those tunnels, and we hope to continue to see that. But today I have a special guest, and I want to just set the groundwork here. As we're going forward with a lot of these Facebook Lives and these webinars, the approach that Dental Intelligence is taking is more or less, how can we just continually add value to the dental professionals, educating them the very best we possibly can with the perspective that we have. Now, being a data and analytics company, we do have a unique perspective because we have over 8,000 practices that we can see the data and what is happening inside of the practice. And we know that numbers don't lie, and numbers tell a story. And that story can be good, it can be bad. And our whole purpose with this is what we call, and many of you may have heard this term, GIGO, good in, good out. We want to make sure that as you're inputting information into your practice management software, that every person in the practice, every dental professional knows the importance of good in, and then of course we get good out. And that only allows you as a dental professional to provide better patient care for your patients, knowing that you have all that information correctly you've entered it correctly into your practice management software, but also how you can be proactive in helping those patients, take care of their mouth. And so today we have Mickey from Open Dental, and I'm so excited. I've really enjoyed getting to know Mickey over the last couple of weeks as we've been on a couple different webinars together, getting to know each other and preparing for this. And Mickey, are you there? I want to make sure that you can hear me and I can hear you and all of our audience can hear you.
I am here. Thanks so much, Jerem.
Awesome. Perfect. So Mickey, I've got a couple questions for you. I really want our viewers to know who they are talking to. So I'm gonna, if you wouldn't mind, take just a couple minutes and tell us a little bit about yourself, how long you've been in the dental profession, how long you've been with Open Dental, and what you do for Open Dental.
Absolutely. So I have been in the dental field for going on 23 years. So I was like 12 when I started, or at least that's what I like to tell myself anyway. I have done front desk. I have not worked in the mouth because there are icky and gross things in there, and I don't do icky and gross well. So my focus has always been front office, financial, insurance, and that's really where I get all excited. I am a self-proclaimed insurance nerd, and the folks around the office laugh at me because of that. I have been with Open Dental for nearly 5 years, and best transition I ever made in my life. Amazing company to work for, especially in these times. So personally, I live with 2 cats that I do think are plotting to murder me on a regular basis. Toby and Chase, and they're both asleep basically on top of me at this moment.
So for you guys that are watching this and will be watching this, I've had an opportunity to meet Toby and Chase, and they have some incredible personalities. As we've been in, serious conversation, they seem to just work their way right, as exactly what she said, right onto her lap, and will join us in those conversations.
Yeah, they're characters for sure.
Awesome. Well, Mickey, we are super grateful that you've joined us on this, and we're really looking forward to the content that you're going to provide. And once again, for those that are watching, this is Mickey from Open Dental. And for those that maybe don't know what we refer to as the Profitability Formula, it's really simple. It's a formula that Dental Intelligence trademarked a couple of years ago. And it really just keeps things simple. I'm not a doctor, but I love to talk in Dr. Seuss terms. If I can get cat in a hat, then I think that most people will understand what it is that we're trying to talk about. And so when we talk about the profitability formula, really what we're saying is we're going to look at how many visits are coming into the practice. And out of those visits, what is our production per visit? And out of the production that's being done, what are we collecting? And as we minus our overhead, we're left with profits. And within each of those levers, we're going to dive deep into open dental and learn how we can increase patient visits and how important that information is when you enter that new patient information in, or if they're coming back through recall, reactivation, etc. So with that being said, Mickey, I am going to turn it over to you.
Perfect. So, folks, one of my favorite things is working with offices to understand how really to use the software. So, with Open Dental, I am a trainer. I lead our clinical escalation team. So, working with offices is my passion, and this is what I live for and what I do every day. So, working with you to understanding our reports and the lists we have in the system to help you increase your patient visits is what we're going to focus on today. So, as we go through and we talk today, we're going to talk about our recall list, how to set that up, as well as how to use it, our unscheduled list, the ASAP list, planned appointments, so the planned appointment tracker, and the treatment finder reports. All of these lists and reports are ways that you have to fill your schedule and to keep it moving so that you've got people lined up if somebody cancels or no shows. So, we're going to start our focus with recall because, as you are all aware, recall is the way you fill your treatment schedule. New patients are great, but you could have 100 new patients in a month. You're still not necessarily going to fill your treatment schedule. You're getting most of those out of your recall chair. So, let's talk about how to set recall up to make it more efficient for your office. The first is going into the recall setup. And to do this, you're going to go into setup, appointments, and recalls. The recall, not recall types, but recall. And this allows us to set up our recall list. Through here, we have the ability to customize messages and update how often we want to remind patients to come into our practice or that they're due for recall. So, as we take a look at this up at the top, you can see that we have a number of remind column, a mode, and a message. And basically, what this means is that the first time I contact a patient, I can send out a separate message from the second and the third and every subsequent time. So the first time I contact a patient that they're coming up due for recall, it may be like, "Hey, don't forget you need to come in for your cleaning appointment." The second message may be like, "Hey, we've missed you at your appointment." And your third and each subsequent could be like, "Hey, we're really concerned about your dental health. Please give our practice a call." So you have absolute control and ability to customize these messages to meet your practice needs. You can have a separate message for email and postcards. And you, by just double clicking into the message area, you can change what those messages say to customize them for your practice. Anything in that middle section under where it says subject line, anything in those brackets are things that we can pull out of the database to automatically populate into your messages. You no longer have to hand type or use email templates. Open Dental will do all that work for you. As we move down to the bottom, the second most important section is this also show and list number of days since box. This controls how often patients will appear on your recall list. For example, the way the recall list is meant to work is after I set a status, they're going to come off my recall list for however many days are listed in that initial reminder section. Because if I work the recall list today and you work it tomorrow, you don't want to have to see what I did today. You don't want to see those patients. You don't want to contact them. You don't want to have to read my notes. You don't want to have to read the scribbles that I've written on a printed out recall list that you have floating somewhere in your office, because we're dental professionals. We love paper. It happens, but no more. You can actually get rid of your printed recall list if you use the recall list as intended by Open Dental. So after that set number of days, so typically like 15 days, if that patient hasn't either come in for a visit or scheduled a recall appointment, they'll be back on my list for me to contact them again. That's where the second or more reminders come in. So that next time I contact them for a reminder, they're going to come off my list for that specified number of days. And if they haven't met one of those two criteria of either having come in for an appointment or scheduled an appointment, they're going to be back on my recall list. So I know they're due to be contacted again. And lastly, I can set a maximum number of times that I'm going to contact them before I leave it up to you, up to them to come in, because I don't want to sit here and chase Jerem and contact him 10 times to come in for his recall visit, because A, it's going to annoy him, but B, it's a waste of my staff time, because at some point it's not worth trying to track them down anymore. So if I were to put, for example, 4 in that box, it means they're actually going to get 5 contacts. The first one, we don't consider that really a reminder. That's notification that you're due. And then they would get 4 more reminders. This also helps keep your staff from chasing their tails on the recall list and again, contacting the same person 10 times. Now, as we move on, to make the recall list really function, it's extremely important that the patient's recall interval is set up correctly. And we control that on an individual patient level in the family module. So if I'm in the family module, if I double click in the the box we have outlined in red in the recalls for this patient, I will get the screen that we have up at the top. This allows me to determine if the patient is prophy or perio. Again, something that is incredibly important. Perio patients typically come in more frequently, but you want it set up on the right option, because that determines what gets added to the appointment through the make recall button, which we're going to talk about shortly, because if you're not using it, you absolutely should be. If I double click on any one of the patient's individual recall types, I will see this edit recall screen. This edit recall screen allows me to change the number of months by just double clicking on it. I can now change the number of months of this individual patient's recall. So this patient should be coming in every 4 months. I would change the number of months to 4. If they're low caries risk and you only do bite wings every 2 years on them, I can change the number of years on my bite wings in order to accommodate that and make it appropriate for this patient. Also in this section, and you can access this same screen from the recall list, which we'll talk about shortly. If your patient, you've contacted them or they've called in, they're unable to schedule an appointment, but they want to come in as soon as they can, as your next available opening. What you can do from here is mark them as ASAP and enter an administrative note. That administrative note that you enter would be what they're looking for. So if they have specific dates and times or days of the week that work for them, if you enter the note there, when we work with our ASAP list, which we're going to talk about a bit later, that note will display on there. So if they want Tuesdays at 3 and you have an opening Friday at 8, you now know you don't have to waste your time contacting this patient, because they're only available Tuesdays after 3.
Mm.
So from there, we're going to talk about the make recall button, because it has magic powers. So it does several things for us. One, it creates the appointment and it puts it on the pin board for us. It attaches all of the patients due recall, all of the recall procedures that are due for the patient. So if the patient's due for x-rays, if they're due for an exam, if they're due for a pano, fluoride, whatever we saw in that recall box at the top in the family module that it detects the patient's due for, it's going to automatically add that to the appointment for us. The nice thing about that recall section is we can actually do customized recalls. So if you perio chart once a year and you want to keep track of when the patient's due for perio charting, we can set up a custom recall type to automatically now start having that added to your appointments. So there are all sorts of things the Make Recall button does. In fact, depending on your schedule setup and how things are set up, it can actually advance your calendar out to that patient's recall due date. So you no longer have to click the arrow or click on the month and advance the calendar. It's going to do that work for you. So always use the Make Recall button. If you're trying to schedule a recall, it saves you time and energy. Now, on to the recall list itself. The biggest thing I have to say about the recall list is do not print it. The recall list, so we have several reports in Open Dental that are meant to be functional reports. The two biggest culprits that people print are this and the outstanding claims report, and neither of them should ever be printed. There is too much built-in functionality in the list for you to print it. So from here, this is going to track for us the patients that need to be called and the patients that we've contacted and we need to contact again. So as we click through it, if we're focusing up on the top of the list can be filtered by due dates. So I can look at people, if I set the from and to date, that are due within a specific date range. I can set the number of remind. So, how many times have we reminded them? I can sort by specific recall types, specific primary providers, or specific, if you have clinics or sites turned on, I can also look at specific sites or clinics. There's the option to group by family, which I think always should be turned on. And what that's going to do is if I have two members of the family, one's due on the 1st and one's due on the 15th, it's going to take the person due on the 1st to move him down by the patient that's due on the 15th. That helps avoid bringing patients in too early. I'd rather bring in a patient a week or two late than bring them in too early and mess with their recall frequency and potentially their insurance. Anytime you set one of these, you're always going to want to click the refresh list option just to make sure we're dealing with the most accurate and current list. From here, if you're going to contact a patient, you always want to use the set status option because this is going to update our number of remind and our last remind dates. And so I'm going to ask you to flash back for a second to when we were looking at the setup screen and we were talking about how patients get pulled off the list. Well, that's what this number of remind does. So the first time I pull them, I contact them, they're going to come off the list according to the setup we have for one day. So I contacted this patient on 8/25. They came off the list for a day and now they're back on, meaning I know I now have made one contact with the patient, but I need to follow up with them again. This is the date I set the status, and here's what that status was. The other thing setting the status does is it actually pops up the ComLog window for you and starts our ComLog. So if I click through, it started the ComLog because I clicked on that patient. So it made it a recall type. It put in the message that or the status that I started with. And now I have the ability to type in anything else I want. But it did that automatically. I don't have to do multiple steps. Where if you were printing this list and using your highlighter and scribbling on the list, I've been there, I've done it, I understand, and I know it's hard to give up the paper, but just trust me. You would then have to go in, you have to search for the patient. So you have to go to select patient, you have to bring up the patient, and then you manually have to type in a call log that you tried to contact the patient for recall. When we can have the system do all the work for you. So much better. So down at the bottom, the other things that the recall list can do for us, if we look down at the bottom, we do have the ability to print postcards from our recall list. The nice thing about it is you don't have to highlight anybody, or you can highlight a group of people. And what it's going to do is it's going to bring up a preview. When that preview is done, it's going to ask you if everything printed right. And if you say yes, it's going to update their number of remind, their last remind, it's going to set their status, and it's going to create a comm log on every one of those patient accounts for you. It does the same thing if we go to print single labels or emails. It's going to do all the same thing. And it's a very little work or effort from you as an office than to maintain your recall. Okay. So that kind of wraps up recall, and I hope that gives you a much better understanding of how the recall list actually functions and how it can work better for your practice. Next up is our unscheduled list. So the unscheduled list is meant to be a very short list of patients who need follow up regarding an appointment. So these are going to be patients that have called you, kind of canceled their appointment. You want to follow up with them next week to get them back on the schedule. This list should be kept short and it should be routinely maintained. So if you haven't deleted somebody off of there or you've made contact with them, we should be pulling them off of this list so that it stays manageable. And one of the things that I see happen in a lot of offices I work with is they don't use these lists because they are so unyieldly. They're so big, and because nobody's ever taken the time to maintain them. So if we do a little bit of maintenance work, these lists can help you fill your schedule. So I'm going to click through. One of the things, and you guys have probably seen this pop up, and you probably get annoyed because there are pop ups, but pay attention because this one is actually really great. If you have ever sent an appointment to the unscheduled list and you go to schedule that patient again, you're going to get a warning that pops up that says, hey, there's already an appointment sitting on the unscheduled list. Do you want to use that before we go through the work of recreating that appointment? So it lets you take that appointment that was already created and use it again, as opposed to trying to remember how much time, or looking through notes or taking a wild guess at what doctor wanted to do and how much time they needed. We can use that appointment that was already created. After contacting the patient, though, so you use it to follow up, you contact the patient once, maybe twice. They don't want to schedule. I would delete the appointment off the unscheduled list. That does not delete the treatment. And if it was a planned appointment, it doesn't delete the planned appointment. It literally just deletes that instance of that appointment. And the last thing is that recalls should never, ever be sent to the unscheduled list. Because if I send it to the unscheduled list, it's possible that you and I are working two different reports. So you're working on the unscheduled list and I'm working on the recall report. It's possible then that we're going to contact the same patient on the same day because they're sitting on both reports. And we don't want to annoy our patients and we don't want to look silly in front of our patients, because that's one of those things that happens. We've all done it. But if we can try to minimize that. So there is a setting that can be done to help avoid this from happening. So if you go into setup and appointment preferences, down at the bottom of your screen, there is the ability to check for do not allow recall appointments on the unscheduled list. This will prevent those appointments from going to the unscheduled list, meaning if they break their recall appointment, they just fall right back on our recall list and we manage them from there. Next, let's talk about our ASAP list, because this is the best way to fill your schedule. Especially those short notice, no show. I'm running 102 fever, especially in COVID times. We don't want them anywhere near our doors.
Mm.
So, having an ASAP list that is robust is the best way to help schedules. There are two different ways that we can add patients to the ASAP list: by right clicking on the appointment and selecting ASAP from the drop down, or by using the ASAP, double clicking into the appointment and selecting ASAP at the top. I prefer the double click in and use the checkbox at the top because, again, I can put my appointment note, like that administrative note we did for recall, about what the patient's looking for. So I'm not wasting my time contacting them if it's not an appointment time or date that works for them. So then we have our recall list, which is in our appointment module under our lists. Sorry, our ASAP list, not our recall list. And these are literally just patients. It'll show you the patient's name, the date, the appointment status, who the provider is, what procedures are on the appointment, how long that appointment is, and then those notes that we have. I can filter this list by the provider, by the location. I can also filter this list by a code range. So if I have somebody that's coming in for scaling and route planning, SRP, I can filter the list and only see my SRP patients so that I can use them to help fill my hygiene schedules. So this is a list. The appointments tab is a list of appointments that are scheduled that are marked as ASAP. The recalls tab is a little deceptive because you would think that that meant recall appointments, right? That are marked as ASAP, but it doesn't. So if the appointment exists, they're on the appointments tab. If the appointment doesn't exist, so I'm going to ask you to hearken back again to when we were in the recalls for patients and we talked about the administrative note box and the ASAP checkbox right there. Those are what are going to show up on this recalls tab. So it's patients without a scheduled recall appointment that were marked as ASAP. This allows you to capture those folks that didn't want to schedule but wanted to come in as soon as you had an opening. And that's how we track those. Next, we're going to talk about our planned tracker. If you guys don't understand what planned tracker is, this deals with our planned appointments. And if you're not using planned appointments, please start. Planned appointments are amazing. Planned appointments, if your office is anything like my offices ever were, there was always tension between the front and the back office over how things got scheduled because the front isn't in the chair in the room with you. They don't hear what the doctor says. They don't necessarily know how much time doctor needs to complete a procedure. And by the time the patient gets to the front office and they're like, I'll call you back, I got to check my work schedule, they call back 10 days later. The front office either now has to go try and read chart notes or take a guess about what doctor wants to do next. So planned appointments allows the back office to create an appointment without actually scheduling the appointment. This helps improve accuracy in scheduling because now when the patient calls back, the front office is going to know exactly how much time and exactly what procedures you wanted to do on that next appointment. They no longer have to take a guess. So by creating these, it gives your front office a lot more solid data to work from. So when the patient calls back in 10 days, they can take this appointment, they can plop it onto the schedule. This prevents them from overbooking or underbooking time for you, which keeps your scheduling accurate, which means you can fit more patients into your schedule the more accurately we schedule. And that starts in the back office because the back office has to be able to tell the front office, doctor needs this much time. And lastly, we're going to spend a fairly good chunk of time talking about our treatment finder report. So, our treatment finder report, we find it by going under the reports menu. It's on the right hand side under lists, and it's called the treatment finder. The treatment finder, when it runs, it is initially shows you all the patients with treatment plan procedures that have insurance benefits remaining. So this is where you're going to send out end of the year benefit remaining letters for all of your patients. You want to get in touch with them. This is where we're going to create this list. This is where we're going to do the mail merge. And we're going to do the letter preview. We can print the labels. We can do all of that right from this list. So as we talk about it, there are several things to know. First, we can include patients without insurance, and we can include patients with upcoming appointments. And I prefer that you always check those two boxes because this list, if they have a scheduled appointment, including just a recall appointment, they're not going to show up on my list. So if I'm sending out benefit remaining letters and they have treatment that needs to be done, I still want to get in touch with them. If I'm trying to fill my schedule, I still want to get in touch with them because it's possible their recall visit isn't for 5 months, but they've still got fills or a crown or a root canal that need to get done. So by including the patients with the upcoming appointments, I'm going to capture all of my patients. Next is the TP since date. So I have the ability to say, only show me the patients that have treatment plan procedures since a specific date. We all know that it's easier to get patients in that have been treatment planned within like the last 6 months. So I can do that and focus my efforts there and do a different set of information for patients that were treatment planned older than that. I also have the ability to filter by provider. That provider filter right there is only the patient's primary provider. It is not the treating provider on the procedure. We are working on that. It's something we have a job in and will be in a future update that will have the ability to sort this list by treating provider versus just the primary provider. And I can filter by code range. And why I think this is amazing is especially when I'm trying to fill my hygiene schedules, right? So maybe you get a 2 hour opening and you're like, I can fit 2 quads of SRP in there. So I could contact one SRP patient or try and get 2 prophy patients in. I'd rather call one patient than two. Like that just saves me time and energy. So by coming into this list, I can enter a code range filter up here for my D4341 through D4342, and it will show me all the patients that have been treatment planned since a specific date that have those procedure codes that have insurance benefits remaining, whether or not they have insurance or not. That's going to show me like, that's a great list. It's fantastic. But the other thing, if you're using this as trying to fill your schedule and you're like, but if I include patients with upcoming appointments, I'm going to get patients that only have recall procedures. And you're right, you are. But what you can do is enter in that code range D2000 to D like 7999. That gets you all your treatment codes, leaves off your exams, your x-rays, your prophies, your sealants. All of that will drop off the list because we're then only looking at our restorative codes. So by maintaining this list and working with it, this is how you're going to track all of those patients that you feel like fall between the cracks. We all have those patients you feel like fall between the cracks. We don't follow up, they don't call us. Between working this and working our recall report, those are how we catch all those patients that are falling through the cracks. Making this a regular part of our day or our week or our month, contacting these patients and working with them is how we manage that. Down at the bottom left, we have the ability to do a letter preview. So if you have set up a sheet in under setup and sheets for a letter to go out to the patient about benefits remaining, there are things that you can do to pull in how much benefits they have remaining, that kind of fun stuff. And those can be sent out to the patients, as well as you can then just print off either individual labels or a sheet of labels to go out to that same group of patients. So really with Open Dental, those are the 5 reports, the 5 lists I would use if it were my practice to help keep patients in my chair and increase their visits. It's important that we're getting them in for their recalls on time when they're due, and that that recall list is set up and that we're working it off the computer and not a paper list. That we're utilizing our ASAP so that we can fill in those short notice cancellations that always happen, that we're using our unscheduled list to keep track of those patients we want to keep track of in a short time, that we're using our treatment finder report to track down those patients who have treatment that need to be done, but we haven't heard from in a while. And lastly, by using our planned tracker to help us accurately schedule your patients so you can get more visits in a day.
Well, Mickey, thank you so much. I'm usually a person that has many words, and right now I'm speechless. I'm like a sponge soaking this in, and I absolutely love the methodology that Open Dental has here. Really, what I'm taking away from this is if we take the time to one, understand the tools that we have at our disposal. What I just saw were so many different ways that we can be efficient and that we can maximize what's happening inside of the practice. And on top of that, maximizing the healthcare that is needed by the patients. And so I commend Open Dental, and I can't thank you enough for taking time and giving us a tip of the week for Open Dental practice management software. And look forward to many more with you and learning much more with you over the next several weeks.
I'm looking forward to it. I can't wait until next week we talk about increasing your production per appointment. That's going to be a lot of fun.
Yes, I can't wait either. So for all those that are watching, thank you for joining us, and make sure you come back next week as we'll hit it again with Mickey and get that tip of the week. Have a good one.